I'm Ashley Anderson here with Dr. Robert Harrell of the Harrell Dental Implant Center. Thanks for joining me.
Thank you. Glad to be here.
The way that you all place the implants in your practice really sets you apart from other practices. Can you explain that?
It does. It's the technology in our practice that really drives how we place implants. So we use a process that combines our 3D cone beam scan. We also use our CEREC OmniCam system, and then we can merge the data from both of those technologies to create what's called a surgical guide. And this is a really marvelous little piece of equipment. But what it does is it allows us to take the planning phase, and we do that together with the patient where we look on the monitor and we go ahead and plan for the placement of the implant. And then from there we can print a surgical guide. And what the surgical guide is it's a little appliance that slips into the mouth, and it contains a little metal sleeve. It allows us to position the X, Y, and Z coordinates on our implant. So we have position, angulation, depth of the implant are all guided by the surgical guide. So in many practices they place their implants freehand. Well, freehand can work okay for an excellent surgeon under the right circumstances. But with a surgical guide, we know exactly where that implant is going, and we've determined it ahead of time, and it's unbelievable how accurate that is when it transfers into the mouth. So again, we talk sometimes about reverse engineering. What we need to establish first with a dental implant is what type of tooth is going to go on top of it and where does that tooth need to be. And so from there we can reverse engineer the process of where the implant needs to be in the jawbone to properly support the tooth. The advent of digital surgical guides, it's really taken our ability to place implants with a very high level of accuracy to a whole nother level.
And aside from the confidence that would give the patient and the comfort, of course, talk about how that helps the jaw alignment and the bite. I imagine that precision is necessary to have a good bite.
It is, and that's something that a lot of people don't really think about, but there are some engineering principles, if you will, into how implants need to attach to the prosthetic teeth for proper function. So again, if we determine where the teeth need to be positioned ahead of time in our planning software, and then we can reverse engineer the placement of those implants, it really does allow us to build something that's not only aesthetically beautiful, but mechanically correct, so that it's going to really function the way the patient needs it to.
Dr. Harrell, thanks for your time today. We've learned a lot of helpful information today, and I hope you at home learned something as well.